Now, the Limpopo government is concerned by COVID-19 cases in the mining industry. At least 19 workers tested positive for the coronavirus at the Implats Marula mine. Now, the mine has since been closed. Government has insisted that mining houses screen and test workers to prevent positive cases from entering the workplace. Limpopo Health MEC, Dr. Phophi Ramathuba, speaks to us now via Skype. MEC, thank you very much for your time. Firstly, your tracing teams, have they been able to detect whether these workers contracted the virus within Limpopo, or were they coming from outside the province?
Morning, Phophi, and morning to all your viewers out there. As it is for now, we cannot be sure as to where is the origin, but the fact of the matter is we do have some contract workers who came, some from as far as Eastern Cape, who tested positive first. And unfortunately, while we appreciate the fact that most of our mines have strengthened the capacity to screen and test, but the weaknesses on our emphasis, which is the quarantine part and the isolation part, is the one which is a serious problem for us. Because when they screen and find you a risk, or you are coming from a high endemic area, they screen you and test you, but they don't quarantine you. And when they test you to be find you to be positive, you would be told to go and isolate. And when we look at the residential area where most of our mine workers are residing, it is very difficult to isolate. That is why now you would have had our emphasis has been, please, the screening cannot go without your quarantine, and your testing cannot go without your isolation. And even those that test negative, as long as they are close contacts and they are at risk, the mere fact that you did tested them, meaning they are also at risk, you must quarantine all of them and make sure that you observe them for 14 days. We did quarantine those that came from China who tested negative, because we knew that this virus has got an incubation period of up to 14 days.
MEC, let me ask you this question then. So if mine workers test positive in a mine, what do you want mining companies to do? What should be their responsibility?
They must isolate all those who are testing positive. We will work with them to monitor those that they are isolating. Our officials will make, look, when you come from, let's say, I'm coming from a Beggarsport to go to Polokwane. I'm just giving a simple example. In Limpopo, we have defined Beggarsport as a hotspot. When you come here, your employer must screen you and quarantine you while collecting the specimen to test for you. Even if you come with symptoms, when they are testing you, they must quarantine you for that 14 days.
Do these companies have space? MEC, I'm sorry to cut in, but do these companies have space to quarantine workers? I know that some mining companies do have hospitals, but it may not be all of them. Where should these workers be quarantined?
I think in the mines, like the very same Marula Implats, which I can tell you the Premier led us to go and visit even prior to this. They show us beautiful quarantine facilities. We are convinced that they do have. I mean, even the mines, all of them in our meetings, they presented that indeed these are the facilities, because that was the requirement. For me, when I listened to the Minister of Mineral Resources on Sunday, he was saying it is the requirement for the mine to be able to have the capacity to isolate. Now, what we are saying as a department is to say, while we are in this battle together, if it's better for you to say to us as a department, we couldn't isolate this person because we don't have the capacity, but rather leaving the person to go and we are not even aware. It's us who come and pick up that person when he has already done the damage by infecting others.
Yeah.
So we cannot take that as an excuse. We are saying if we want to work together on this, people must be open and they must be transparent. Anyone who tests positive, mine has got the responsibility to isolate so that they can protect others, unless we don't want to see our mine continue with their operations.
MEC, the next biggest challenge are schools. The Minister of Education will likely address the nation today. In your view, is your province ready to reopen schools? I know you're not the Education MEC, but surely you are among those that are being consulted.
I think we're working very closely with the Department of Education, with my counterpart, MEC Michelle. We had anticipated, just like we did with the mines. We knew that at some stage they will open, hence we call upon them, we called DMR and gave our proposal to say this is what we need to do, because we need to balance. We are saying as a Department of Health, while yes, we want to save the academic year, at the same time the saving of lives must be the priority. That is why we put up our proposal to say this is what needs to be done.
What
it's
is
still a work
that
in
needs
progress. The protection of our, not just mainly our learners, because most of our learners, if we look into that, they might get the virus. Those who are not having comorbidity, it might not be so much of a risk for them if they get infected. But our main problem is some of the teachers who, when we look at their health profile, it is a real worrying factor for us. So we are saying...
What's a worrying factor around teachers? Is it because some of them are at around 50 or possibly 60?
Not only that, we have been even yesterday discussing with the MEC, when we look at the health profile for our teachers, the comorbidity, how many of them are with uncontrolled diabetes, how many of them got cardiac problems, how many of those. So those are the worrying. When I talk about the vulnerability that I want to protect at all times, I'm referring to these particular categories.
Right.
So we are saying the issues of sanitization of our school, I heard people are saying we're going to fumigate. The fumigation of the school will not necessarily assist you. We have been, those schools have been locked for more than 50 days now. So what we are really must be focusing on, it's if you are just cleaning, you are cleaning for hygienic, but the sanitization on a daily basis of our learners. And also the good thing is that education is proposing the staggering. And if we can work with those numbers that we can, and learn mistakes that we have made with the older grouping, we will be, even that particular older grouping, it's also a concern for us, because we know some of the grade 12s are already having some comorbidities. But we are working with education. The issue is that we just need to balance what we are going to be doing to say you save the year, but saving the lives must be the priority.
All right. MEC of Health in Limpopo, Dr. Phophi Ramathuba.